In April 2003, China reported a tenfold increase in the number of SARS cases. Beijing's mayor and health minister were fired amid accusations that the real statistics about the disease had been covered up. 6.5 years on, one doctor, known for making his doubts about the SARS statistics public, is questioning whether China's figures for H1N1 deaths are accurate.
The lessons learned from the SARS outbreak in 2003 played a large part in shaping how China first responded to the H1N1 flu virus earlier this year. Determined to take a lead in combating the spread of the disease, Beijing instituted a rigorous series of tests and quarantine procedures to prevent a repeat of the SARS epidemic. But this fall, the number of deaths from the disease is increasing at an alarming rate. With China now reporting its official statistics weekly, the 51 deaths revealed last week almost doubled the total number of fatalities in China. But there's also been skepticism about the official count. One prominent doctor from Guangdong province says he simply doesn't believe it, and he suspects a cover-up by local governments. Zhong Nanshan became well known during the SARS epidemic for speaking out and exposing the severity of the pandemic. Thanks in part to his efforts, the public was alerted to the seriousness of the situation. The H1N1 virus can harm the respiratory system and cause pneumonia, but Zhong told the Southern Metropolis Daily that some areas of the country haven't properly tested deaths resulting from pneumonia to see if they were in fact H1N1 deaths. Though the total number of deaths has risen week by week from 28 to 53 and now up to 104, Dr. Chong said he believed that as with SARS 6 years ago, some regions had concealed reports of H1N1 deaths to create the impression that they had been successful in their local prevention efforts. But WHO spokeswoman Vivian Tan says while Zhong's suggestion about the inaccurate number might be true, she doesn't suspect a deliberate cover-up by the government.
There is no way to make sure it's accurate. And this is not unique to China. Many countries have no way of knowing how many H1N1 cases are really out there.
Tan also believes the number of H1N1 cases reported globally is only a fraction of the real number. For example, the U.S. Center for Disease Control estimated that the number of H1N1 infections in the U.S. could have been 140 times the official number. Tan says many countries have stopped reporting the exact number of cases simply because there are just too many and it's impossible to diagnose and count every single one. While the government didn't address Zhong's comments directly, it immediately responded by promising severe punishments for anyone caught concealing the true number of H1N1 deaths. Ministry spokesman Deng Haihua says 9 teams have been dispatched to 12 provinces across China to oversee prevention and treatment of the flu. And while the most recent statistics have shown an alarming jump in the number of deaths, at least part of that can be attributed to China's new H1N1 accounting method. If a person confirmed with H1N1 dies, the case should now be reported as an H1N1 death, regardless if the patient was suffering from any other conditions. Previously, this was not the case.
So I think what the numbers that are coming out now would probably be more reflective of the real situation.
Deng Haihua also agreed that the death toll might quickly rise because of the new accounting method, but he stressed that the increase doesn't mean the epidemic has necessarily worsened. The WHO reports more than 500,000 cases have been confirmed worldwide, and at least 6,200 people have died of the virus. According to these numbers, the global mortality rate is about 1.24%. And compare that to China, where the death rate is about 0.13%, or roughly a tenth of the global figure. And while the WHO concedes that the rate can vary significantly from country to country, it's that factor of 10 that has made some headlines. Sylvia Gunawan, BON.
And welcome back. More now on Sylvia's story on H1N1. Sylvia, we're seeing a dramatic rise in deaths reported here in China in the last little while. It went from 28 to 53 and now suddenly 104 reported deaths from the H1N1 virus in China over the last week or so. Is this a case of there actually being more deaths, or is it better and more accurate reporting methods?
Well, certainly part of that can be, as I said, attributed to the new accounting method that was adopted earlier this year. But, Dr. Chang claims that, there were some underreporting from the government. of course, that we can't really prove or contradict the claim by Dr. Chong, but the fact that it came from such a reputable doctor,
right.
you know, he exposed the severity of the SARS pandemic 6 years ago, so
Sure,
that's what made the headlines.
Yeah. We wanted to mention one other recent warning from Dr. Zhang. He recently mentioned that the far deadlier H5N1 bird flu virus, which is already endemic here in China, he's concerned about that actually combining with the current H1N1 virus, mutating and possibly becoming even deadlier. So certainly some more dire warnings from that doctor, and
yeah.
you know, obviously every time he speaks about this issue, it gets a lot of concern raised.
Definitely.
Well, stay tuned. BON News continues with Pole Position next.